Neuronetics has developed the NeuroStar TMS therapy system as a therapy for major depression. The NeuroStar system consists of power electronics, a touchscreen control panel, an electromagnetic coil, a single-use treatment link that is positioned between the coil and the patient's scalp, and a treatment chair with integrated head support. The NeuroStar TMS system is prescribed for use by a trained psychiatrist. A typical acute course of therapy with the NeuroStar system involves 20 to 30 outpatient treatment sessions and spans 4 to 6 weeks. Each session includes the delivery of 3,000 pulses and requires 37 minutes to complete. The patient is awake and alert during the procedure. No anesthesia or sedation is required. Upon completion of the session, the patient can immediately resume normal activities. To begin use of the NeuroStar TMS system, treatment location and treatment level are determined by locating the patient's motor cortex and defining the motor threshold. The motor cortex is located by energizing the coil with single pulses as the coil is moved over the motor cortex region. The coil is positioned over the area that produces a visually identifiable movement of the right thumb when stimulated. Motor threshold is the minimum stimulator setting required to activate the region of the motor cortex that controls the right thumb. Treatment power is then based on the observed motor threshold. The location of treatment is also determined relative to the motor cortex. To begin treatment, the coil is moved 5 centimeters anterior from the motor threshold location along a parasagittal line. This positions the coil over the left prefrontal cortex. The treatment can then be started. The NeuroStar TMS system delivers a sequence of 3,000 pulses during a treatment session. The system presents a summary of the completed session for the operator's review. The patient is awake and alert and can immediately return to work or other activities upon completion of the procedure.